Good morning and welcome back to the Tobago Updates Morning Show. And we have on the line with us right now Mr. Kenneth Suratt, who is the Executive Officer in the Trinidad and Tobago Blind Welfare Association. And he's coming to speak to us about World Sight Day 2025. Good morning and welcome, sir.
Good morning. Are you hearing me loud and clear from Trinidad?
Yes, I'm hearing you
And good
loud
morning,
and clear
Trinidad and
from
Tobago.
Trinidad.
And what's a wonderful day to be alive.
Yes, indeed. So, Mr. Suratt, let's get straight into the interview. Tell us about World Sight Day.
So, World Sight Day theme is Love Your Eyes. And the Blind Welfare Association, we are heavily involved in rehabilitation. So, what we suggest is that you'll see I had a press release where we were very pleased that the government added some important drugs on the CEDAP program. But for some years now, we've been campaigning for a specific glaucoma drug to be added on the list. It is very costly, and sometimes when persons who are blind go to get it, they're out of stock. So we are saying we want this drug to be on the CEDAP list because it reduces the pressure on the eyes. There are persons who are blind, they can't see anything, but they are still affected with glaucoma and it impacted negatively on their lifestyle. So if they have this drug and they put it in their eyes, it will reduce the pressure in their eyes so that they don't feel that pain. Also, persons we want to prevent them from going totally blind because not everybody on our list are totally blind now. What that means, no light perception like me. I don't have any light perception. So you could flash a light in my eyes, I wouldn't see it. But we have persons who are blind who are mild, moderate, or severe visual impairment. This glaucoma drug will help them to maintain the little vision that they have. And it does help. They may not be able to read a print book, but the little vision you have, you can identify where there's a doorway or if the light in the house is on. And that is so important. There is another group which is diabetic retinopathy. It is a specific injection for the eyes. It is not available in the public health sector, but you can get it in the private sector. We are saying we want that eye injection available in the public health sector. That will reduce the cost considerably for persons who have eye condition because diabetic retinopathy because of diabetes. That will help also to preserve a little vision that they have and help them to move around the house independently. As I said, they may not be able to do things or drive a car then, but they will maintain that little vision they have that they can move around and go about their life. So those are the two main drugs that we want added in the system. The Blind Welfare Association, we don't only cater for totally blind people. We cater for people who fall within the realm of visual impairment. So when you come to the Blind Welfare Association, we will teach you how to do things the blind way. And what is so important is that when we treat with you this way and we give you the skill set as someone who is low vision or visually impaired or totally blind to cope, what happens if you lose all your sight? It will not be as traumatic as if you didn't develop your blindness skills. So today on World Sight Day, we are telling people, love your eyes because I'm totally blind, but I don't want to go to the doctor to remove my eyes because they're not working because I still practice my eye exercises. When I look at people, when I talk to people, I face them and talk. They want to see my eyes, So I still encourage that. What even though you don't have your sight, your eyes may be paining you. Let us try and do remove that person's eyes so that they don't have that pain, because it could impact on your facial structure. So we are saying keep your eyes even though you're not working properly. We want you to keep it. We want you to use the glaucoma eye drop so it reduces the pressure in your eyes and give you a better life. So this is what we at the Blind Welfare, we are promoting.
So, Mr. Suratt, you've spoken, you've given us a lot of information just in your opening message.
Yeah.
But I want to find out, in Trinidad and Tobago, do you have any access to statistics in terms of persons who might be blind or visually impaired to the point that they would need the assistance of the Blind Welfare Association?
Well, not statistics in the sense from the CSO, because the last CSO report in 2011, I think we have about 51,000 people with a disability, but it wasn't disaggregated. So statistics is something we call upon the government to use the United Nations short and long questionnaire for the next survey. We are hoping that they adopt it so that we get the true essence of visual impairment. We are saying that also the disability grant, because that will you have to bring in a medical report to determine your visual impairment or your disability to get it. Also at the education level, there is where you ask for concessions for exams that you could get accessible exam material or whatever needs you have. That is another way to pull some statistics together. The Ministry of Health will also have, when you're assessing children after birth and so on, coming up, who has a disability. So there are some type of information there that we could pull that data to give us that information what you're asking for. Years ago in 20, I think 13 or something there around there, the government did a national eye survey of Trinidad and Tobago, and the three causes of preventable blindness was diabetic retinopathy, glaucoma, cataract. Those were the three areas of visual impairment. We also have refractoring. Refractoring means sometimes because of how your eyes shape, you are not the light not reaching the retina properly. I put it in simple terms. With glasses or a low vision aid, that could be assisted without surgery, so you could improve your vision. You'll see some people they might be stumbling along, but if you put on your glasses, they start to move differently because now because of refractor errors and not doing surgery, the glasses could correct that or a low vision aid could assist you. May not be perfect vision, but maintain your, your limited vision so that you can see a little better.
So, Mr. Suratt, I was now about to get into the main causes here, based on your media release, the main causes of blindness in Trinidad and Tobago, and you listed the four, which is glaucoma, cataract, refractive error, and diabetic retinopathy, right?
Retinopathy. Yeah, retinopathy, yes.
Just in your press release, you also stated that these things are preventable. Yeah, I don't know if you could just go through with us and tell us in what ways some of these conditions are preventable or they could be minimized.
Okay, the first thing you should do, have an eye examination, not by an optometrist. I encourage people, once you can afford it, go to an ophthalmologist at least once a year to have your eyes properly diagnosed. So in case you like, for instance, glaucoma is a creeper. It glaucoma deals with your peripheral vision. So let us say, and how the human brain works, it even though you're losing vision, it makes adjustment. So sometimes you're not aware what is happening unless you go and get a proper eye examination by your ophthalmologist. So now that doctor will determine what is the condition of your eyes. If you have glaucoma, or you have diabetic retinopathy, or cataract. Those are the three major causes of preventable blindness, because you could get your sugar test. Make sure that's the thing about exercise. So if you are diabetic, you run the risk of developing diabetic retinopathy. Glaucoma is a creeper, so you could only determine that mainly by going by your doctor, or sometimes at home you could do a simple test. Put your hands straight out on your shoulder like a T in print, and if you are seeing your fingertip, we could say your peripheral vision is good. If you are not seeing your fingertip, gradually bring in your hands towards your chestlet without bending it. And when you start to see your fingertip stop, if you observe that while you're doing that, you have to constantly bring in your fingers to see the tip. That means you have some peripheral loss. So our advice is to go to your ophthalmologist. Once you go there, that doctor will tell you if you have glaucoma, or if you go by a general practitioner, they will tell you if you are if you have diabetic by you're doing your A1C test. I think you do that. That goes back about 3 months to know if you're on the borderline of diabetes or whatever. So if you have diabetes, it's important that you get that regular eye check. Diabetes could also bring on cataract, or with global warming, it is determined that because of global warming and harmful exposure to ultraviolet light, you could develop cataract. So Trinidad and Tobago, we are close to the equator, so we are telling people these things are preventable if you take the necessary precaution, like for instance, wearing the proper shades when you're out in the sun. You know, they talk about sunscreen and so on. We at the Blind Welfare, we promote sunscreen and so on, but also wear proper tested or certified glasses to prevent UV light from reaching your eyes to help it to prevent having cataract. So those are the three preventable causes of blindness, and then we have refractoring. Refractoring is basically using glasses to correct how light reaches the retina.
Okay, and I see in your release you've also spoken about early detection for children. You've raised a number of issues concerning catering for children, in learning, and also early detection for children. Just speak to us in terms of what impact that will have if we engage in starting to test children from an early stage.
Okay, there's a window for a child up to age 8, I think, scientifically. If you don't treat with that child early o'clock with detecting their visual impairment, because the first thing you want to do, you want to detect it and see if it can be corrected. If it can be corrected, you have that window up to 8 years. So that 8 years, if you don't correct it, the brain doesn't learn how to see. So say for instance, if I born blind, but corrective measures could have given me back my sight, and you don't do it in time, if I reach the age of 10 or 12, whatever, you could do what you want. The brain already developed and it cannot see. You cannot teach the brain to see again. So we are saying that window for a child is different than an adult. The government must make sure we have plans in place to detect the visual impairment of a child early o'clock, have it corrected early o'clock before 8 years, so the brain could be taught how to see, so that child could live a fulfilling life. There is the other aspect now. If the child's sight cannot be restored, we need to introduce that child to rehabilitative services from the Blind Welfare Association as early as possible, so that the brain now could use alternative, we call it neuroplasticity, rewind itself to assist that child to excel and to achieve and to do well. So that child fine motor skills, their hearing skill, their mobility skill, how they function as a child who is blind, helps them to function as an adult. And the children who do well, the children who do well at rehabilitation do well in life also. So early in detection, we don't have that luxury of time with a child. That window of 8 years is where the child absorbs things rapidly. If you go back to your own life, at that childhood age, every single thing you absorb like a sponge. So we want our children who are blind have full access to that rehabilitation.
So, in the experience of the Blind Welfare Association, is it that you've seen or that parents aren't taking those measures to really have that corrective, those corrective procedures being done for their children, or is it that the parents are seeking it out, but the services are not available or not easily available in the public sector?
There are parents who seek it out, but we have done surveys or samples based on children with disabilities. Sometimes you have to wait 24 months to see a specialist. That in Trinidad, we strongly ask the government, please reduce the waiting list for a parent who has a child with a disability, not only blind, but with a disability, to see a specialist as early as possible. We cannot, I can't stress it enough. A child doesn't have that window of time. We need to move quickly on it.
And you also spoke about, in terms of cataract surgeries, you actually spoke about the expansion of cataract surgeries in Trinidad and Tobago to help with the reduction in persons experiencing blindness in Trinidad and Tobago.
Okay, years ago, under the Kamala Prasad previous administration, they reduced the cataract waiting list to 3 months, which is the international standard. People shouldn't go blind because of cataract. Over the years, that has fallen, and we are asking the government to go back to that program, or you can improve it, whatever it is. But the goal is that someone shouldn't have to wait for more than 3 months to have a cataract surgery. And what we are saying, sometimes do cataract surgery in one eye. So one person, you might need both eyes, but you can get two persons getting one eye. So you do one, and then the next year you do the other one. So you gradually give people an opportunity to at least have one eye done. That way, you could reduce the waiting list. And two, people shouldn't go blind because of cataract. And let us go toward the international standard that within 3 months you should have your eyes tested, examined, and a cataract surgery performed, so that you could be back on the job, back on, getting along with your own life, especially the elderly and so on. People shouldn't go blind because of cataract.
And finally, I saw that you called for inclusion of systems and testing methods into the government systems, into the healthcare system, and And these are called the Certificate of Visual Impairment, which was developed by the Trinidad and Tobago Blind Welfare Association, as well as the Washington Group questions. Just give us an idea of what the CVI and the Washington Group of questions are really about, so that we can understand why it is you want them included into the healthcare system.
Okay, the Washington group of question, that be long and short one. So we are saying, sometimes when you're doing a survey, let us say the CSO, when they will ask how many blind person in your house. If someone has low vision, you wouldn't consider them to be blind. But if you ask the question differently and you say, when you are watching television, how close do you go to the television? Or if you are reading a book, how do you hold a book? Be the mere fact that asking that question and you hear someone say, well, I have to bring the book close to me, or I have to sit closer to the television to see, immediately that person have some level of visual impairment by not asking if there's any blind person in your house. So how you ask the question, you get the desired answer. So the goal is you want to find out through your question here, how many people in this country have visual impairment or even hearing impairment. You'll ask, if you are listening to television, how low what volume level do you have with that? That will give an indication your level of visual impairment or hearing impairment or some form of disability, right? So we deal with that level. That is to work with the government, the United Nations short and long term questionnaire to determine visual or hearing impairment or some form of disability. So that is the part we talk about using the Washington group of question. How do you ask question to get the desired answer? Because the World Health Organization say 15% of your population has a disability. We below that, right? So that is that aspect. The Blind Welfare Association is called upon government. We must determine or define disability or visual impairment scientifically. The Blind Welfare Association developed a certificate of visual impairment form that any practitioner, medical practitioner in the health sector or doctor could do a check and determine your visual impairment. So we are asking the government to implement our CVI form so that if you're looking for any grants at the hospital or you are going for your driver's permit, you should be able to take this CVI form that was developed by the Blind Welfare Association, take it to your doctor, any practitioner in the government health service, and they could complete this form to know your level of visual impairment. So it have mild, moderate, or severe. So we are asking for those two things to be added also, because presently disability is measured based on the doctor's position, but not scientifically. So we have developed this form so that you can measure your visual impairment scientifically. And I want to toss in here, I am totally blind. Medically, I am certified totally blind, medically. But my level to function is higher than the average person. Because of through the Blind Welfare Association, I learned my mobility orientation skill, learning using use technology and so on. My ability to function independently lifts my level of disability. So while medically I may be certified by a doctor that I am totally blind because I don't have light perception, but my level to function is great. So it cancels out my level of disability because my ability to function. So that is the association position, the measurement of functionality and the measure of the medical model of visual impairment.
And finally, Mr. Suratt, today is World Sight Day 2025. What does the Blind Welfare Association have planned for today?
Well, our plan is really to advocate, sensitize people about, first of all, love your eyes. And even if you are totally blind, still love your eyes because we want you to keep your eyes. Make sure if you have glaucoma, the medication is there, even though you cannot see, but to give you a life. So when you touch your eyeball, you feel your eyes. Yes, I still enjoy touching my eyes, even though I cannot see. Because maybe down the road, science or some kind of miracle might take place, but I'm not waiting on that. But I love having all my parts that the government give me, or not the government, the doctors or the Lord give me, and I'm happy to have it, and I want to protect it. Tell people protect your eyes. If you have a little bit of vision, try your best to protect it as much and keep it as much as possible. So loving your eyes is loving it based on the spectrum of visual impairment. And enjoy today. And today is a special day. Have high expectation for your children who are visually impaired. Encourage them to go to school and achieve. And the world make me blind is not because I'm blind, because the infrastructure or your attitude towards me as someone who's blind. Because we often see persons who are blind, problem is not the person who is blind, it's people's attitude to persons who are blind. So we are calling on people, love your eyes today, change your attitude towards persons who are blind, and work toward developing a universally designed Trinidad and Tobago so everybody could enjoy it together.
All right, thank you very much, Mr. Kenneth Suratt, who's an executive officer of the Trinidad and Tobago Blind Welfare Association, and he was on Tobago Updates Morning Show to talk about World Sight Day 2025 and the Blind Welfare Association's hopes for Trinidad and Tobago moving forward. Up next, we have on Ms. Jolie St. John, who is the newly crowned Regional Junior Minister of Tourism, and she's coming on to speak about her experiences in Barbados earlier this month and being the new Regional Junior Youth Minister of Tourism, as well talking about her business, Gem Concepts Fruity Roots. Yes, that's up next, sorry. But we have to go for a short break, so do us a favor. Share the live, share the live, share the live. We'll be right back after these messages.